Breast cancer risk by race and ethnicity. All women, regardless of age and ethnicity, are at risk of developing breast cancer during their lifetime. Screening and other preventive measures apply to all women. However, the risks of developing and dying from breast cancer vary among different racial and ethnic groups. White women have a higher risk of developing breast cancer than Black, Latino, and Asian women. Black women are more likely to develop breast cancer at an early age, under 50. In addition, there are more cases of aggressive breast cancer, triple-negative, in this population. Black women also have the highest breast cancer mortality rate. This may be due to the more advanced stage of the cancer at the time of diagnosis. Asian women have the lowest breast cancer and breast cancer mortality rates. Several factors influence breast cancer and mortality rates among different racial and ethnic groups. Here are a few examples. Limited access to screening and medical care. A delay in consulting their healthcare provider. Lifestyle and behavioral factors such as eating, exercising, smoking, and drinking can affect the risk of many diseases, including heart disease and breast cancer. In regard to the risks associated with hereditary cancer predisposition genes, several studies have shown that pathogenic variants in the most frequent breast cancer-related genes are present in all major racial and ethnic groups. Genetic testing is therefore an integral part of cancer risk assessment for all women at high risk. However, some ethnic groups have a higher rate of carriers of variants in breast cancer predisposition genes. Women and men of Ashkenazi Jewish descent, Eastern European, have a higher risk of carrying pathogenic variants in the BRCA1 and BRCA2 genes. Approximately 1 in 40 people of Ashkenazi Jewish descent carry a mutation in a BRCA gene, compared to approximately 1 in 300 people in the general population. For this reason, anyone of Ashkenazi Jewish descent with a personal or family history of cancer should consult a genetic expert. There are also more carriers of pathogenic variants in the BRCA1, BRCA2, and PALB2 genes among people of French-Canadian descent. Individuals of Dutch, Icelandic, and Norwegian descent are also more likely to carry pathogenic variants in the BRCA1 and BRCA2 genes. Genetic analyses are currently identifying more variants of unknown significance in Black, Latino, and Asian individuals than in white individuals and people of Ashkenazi Jewish descent. This difference is partly explained by disparities in access to genetic testing. Efforts are being made to increase awareness among the general public and health professionals of the importance of genetic testing for high-risk individuals regardless of ethnicity. In addition, the reference databases used to classify genetic variants contain more information from individuals from white populations. Several projects are currently underway to address the situation.